Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. Covid-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to petting. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
I did not imagine that the prayers of my country would have been answered so swiftly.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18, take the vaccine. To protect your family, take the vaccine. To safeguard the elderly, take the vaccine. To bring back with festivals, take the vaccine. Take the vaccine, take the vaccine. Take the vaccine, take the vaccine.
This is a message from Tasha P. and the Health Promotion Unit of the Ministry of Health, Dominica.
Good evening, ladies and gentlemen, and thank you once again for joining us for this COVID-19 update. This evening, we'll be hearing from Dr. Shaluddin Ahmed, who is the National Epidemiologist. Also, Dr. Ruby Blanc, the Hospital Medical Director, and Superintendent Anthony Lawrence of the Commonwealth of Dominica Police Force. Of course, as we head into the weekend, we always find it appropriate to remind you of the safety protocols, health and safety protocols, and of course of the law to keep our country safe, to keep you safe and your family safe. So let's begin this evening with our statistics, as always, with Dr. Shaluddin Ahmed.
Thank you, Ms. Harry. I recognize presence of Dr. Ruby Blanc, Hospital Medical Director, Superintendent Anthony Lawrence, Dominica Police Force. Listeners, media, good evening to all. COVID-19 status update for Dominica. As at September 30th, 2021, our total number of new cases, 47, 45 of them were antigen positive, whereas 2 were PCR positive. Total active cases, 575. Total recovered cases, 3,006. Total COVID-associated deaths, 21. 48% of our target population took at least one dose of the vaccine. Just to remind that our target population now extended to 12 years and over age group. So that constitutes almost 53,279. 40% of the target population are now fully vaccinated. Our daily trend as it stands from July 28th to September 30th, on average, we have seen about 55 cases per day. 55 cases per day. If you follow the weekly average, you will see a glimmer of hope that we have some degree of plateau going forward. Last 3 weeks, we have seen cases between between 55 and 57 per day, that is. In terms of our active cases by severity as of October 1, 2021. So the percentage-wise, 4% that is severe form right now, that represents 22 cases. Then moderate with symptoms, moderate cases, that represents 28 cases, and that is 6%. And rest are mild to asymptomatic cases. This is almost 90% cases are mild to moderate, mild to asymptomatic. Sorry. Now, severe to moderate active cases as of October 1st, 2021. These cases are in St. James, Portsmouth St. James Isolation Facility, in CSE facility, and Dominica China Friendship Hospital. So these three facilities constitutes the patients that are either severe to moderate symptomatic cases. The blue bar represents number of patients and total number of patients in that facility, and the orange color represents of those how many are vaccinated. The line represents proportion of patient unvaccinated of those specific facility, and then we have national or the total number of cases, those who are severe to moderate as of October 1st, 2021. So in St. James, we have, as of today, 22 cases. Of them, 6 are vaccinated. In CSE, we have 28 cases, only 5 vaccinated. At DCFH, as of today, 6 cases, and all were unvaccinated. So in nationally, as you can see, our total number of cases and their vaccination proportion. Total vaccination, unvaccinated cases are 80% are unvaccinated, only 20% are vaccinated. In terms of the nationally, the proportion of vaccinated and unvaccinated COVID positive cases, the total number here, 2,751. As the number increases over the week, however, the proportion of vaccinated and unvaccinated remain the same. So nationally, we have 74% unvaccinated COVID cases as opposed to 24% vaccinated COVID cases. We just have started giving vaccination to children under 18 years age group. So that data has not come forward as yet in terms of how many of them are vaccinated in that group. However, as you can see, as the age goes older from 18 years to 65 years, we do have proportion of vaccinated cases increases. So at the age of 18 to 35, we have roughly about 21% were vaccinated. But that figure increases when it goes to 36 to 65 years age group to 33%. And it even increases after 65 years to 45%. This is as a result of the Delta variant that we are having. This is a clear indication that we have to be mindful of vaccination. In later slide, I'm going to explain as to what causing this variant to develop, and subsequently makes our vaccination or vaccine more like breakthrough cases or breakthrough cases cause. COVID-associated death, as I mentioned earlier, total death as of September 30th, that is 2021, we had total number of 21 cases, 8 males and 13 females. Their age range from 46 years to 95 years. The median age 81 years. They all had comorbid medical conditions, from hypertension, diabetes to cancer. And vaccination status, 90% were unvaccinated. Sadly, there were 2 vaccinated cases also died. Now, vaccination helps. It reduces the mortality due to COVID. It reduces hospitalization. You have seen it. It also reduces the infection rate. And it reduces the transmission rate. Based on international scientific journal, the transmission rate in unvaccinated is much higher than vaccinated. It also prevents developing a variant of concern. Let's say something more than Delta variant or some future variant that we don't know of. Consequently, it prevents or will prevent the future surge. So we do need your help to get vaccinated. The more you wait, the more you allow virus to replicate in your body, and in that process mutate, and to the point it become a variant of concern, and much more than a Delta variant may cause another surge or lead to another surge. So with this, I'm going to leave you here, and I thank you for your attention, and have a good evening.
And our thanks to Dr. Ahmed, the national epidemiologist, and a very quick recap. Again, our active cases here in Dominica, 575. We're pleased to report that 3,006 people have recovered from COVID-19. However, unfortunately, 21 COVID-associated deaths in Dominica. Next up this evening, we welcome Dr. Ruby Blanc, who will focus specifically on the Dominica-China Friendship Hospital and its response to COVID-19.
Thank you, Ms. Harry. And I would like to recognize the presence of Dr. Ahmed, national epidemiologist, and Superintendent Anthony Lawrence of the Commonwealth of Dominica Police Force. Good night to everyone who've joined us for this press briefing. The provision of healthcare services within an environment that is safe for both staff and patients remain a major priority of the administration of the hospital as we continue to respond to the COVID-19 pandemic. A number of steps have been taken towards supporting this priority, and these include the testing of all patients coming in through the accident and emergency department, Day 5 testing for all patients admitted or once patients become symptomatic, and we refer to symptoms that are related to COVID. Staff testing is to be ongoing so as to ensure that the clinical environment remains as safe as possible. We continue to screen at the gate all persons entering the compound. And in all clinical areas, there is the continued promotion and practice of mask wearing, physical distancing, hand hygiene, and sanitization. Staff have all been trained in the use of PPEs, and they are expected to utilize them as they carry out their various clinical duties. There is a no visitation policy which continues to be enforced. However, there are exceptions for end-of-life situations. In the end-of-life situations, if there are visits, these visits are limited to one person at a time, and visits should last for no longer than 15 minutes per person. Visitors in these situations must present an antigen test, of course a negative antigen test, less than 48 hours old. The reopening of outpatient clinics have begun on a phased approach, and strict guidelines have been developed to guide this reopening process. And that includes the mandatory testing of all patients who seek care at these clinics. Elective surgeries have also recommenced, again with steps taken to prevent the unintentional and unsuspected introduction of COVID-19 into the clinical spaces. For most part, the public has been very supportive of our efforts, and for this, the administration of the Dominica China Friendship Hospital would like to extend its profound gratitude. However, there are still members of the public who do not respect the protocols that have been put into place. Some persons are extremely disrespectful to the staff at the gate, and others use deception to gain access to the compound. We would like to remind the public that these policies and protocols were instituted not to inconvenience you, but for the protection of yourselves, staff, and patients. So please work with us. At this point, I wish to share with you some data regarding patient admissions and COVID-19 from the hospital. And we will be focusing on the period August 5th to September 27th, 2021. During that time period, 113 patients were found either on admission or during admission to be COVID-19 positive. And in this first graph, we see that the majority of these positive patients, that's 35 of them, were admitted directly to the isolation unit at the hospital. The acute psychiatry unit recorded 32 positive patients, and that was followed by the maternity unit or Stronach ward with 22 positive patients. 12 patients came from the Emory ward, 7 from Glover ward. And from the nursery, there were 2 positive neonates. Finally, 1 patient each from Daubeny ward, accident and emergency department, and the intensive care unit. Of the 113 positive patients, only 7% were fully vaccinated. Another 4% were partially vaccinated, which left 89% who were unvaccinated. 7% were fully vaccinated, 4% partially vaccinated, and 89% were unvaccinated. We see clearly a correlation between a patient's positivity and their vaccination status when we look at those figures. At the COVID isolation unit at the Dominica China Friendship Hospital, between the period August 5th and September 27th, we recorded 5 COVID-associated or related deaths. Of these, 4 patients, or 80%, were unvaccinated, while 1 patient was vaccinated. Dr. Ahmed went through the benefits of vaccination, and they're so important, I would like to repeat them. These include a decreased risk of contracting COVID-19, a significant decrease in the risk of having severe disease and death with breakthrough infections. That means if a person who's been vaccinated but still get infected with COVID have a much better chance of doing well, not becoming very ill, and not dying from COVID. Vaccination also decreases in the development of viral mutations and development of viral variants, and there is also the decreased risk of transmitting the disease to other persons. Recognizing these important benefits, the hospital has launched a vaccination drive. During this formal launching, solidarity messages were offered by representatives of the Medical Association, the Nursing Association, and the Public Service Union. This drive includes increased educational activities to the staff on the subject of COVID-19 vaccination, and we've dubbed these activities the Lunch and Learn series. And of course, we have the availability of all 3 types of vaccines, the AstraZeneca, Sinopharm, and now the Pfizer vaccine, on the hospital compound, making them available to staff and patients alike. To date, we have registered interest and increased vaccination uptake by staff members through the vaccination drive. Other members of staff are also receiving their vaccines from sites outside of the hospital. And updated figures are being collected on the state of staff vaccination, and these will be released to the public as soon as available. The benefits of vaccination, which were previously outlined, cannot be underestimated. Alongside other measures, vaccination against COVID-19 plays a critical role in the response to this pandemic. The hospital administration would therefore like to strongly urge those who have not been vaccinated to do so at the soonest. We make a special plea to healthcare workers. A vaccinated healthcare worker makes the workplace safer for themselves, their colleagues, and patients under their care. The hospital would like to encourage the public to continue to work with us, healthcare workers, as we fight this pandemic. Let us continue to wear face masks, sanitize hands and other surfaces, practice physical distancing, build strong immune systems through proper diet, exercise, and adequate rest. Get vaccinated. And also, know your status by getting tested for COVID-19. I must use this opportunity to commend all healthcare workers and indeed all frontline workers who continue to work tirelessly in this fight against COVID-19. Thank you all for your attention and have a wonderful night.
And our thanks to Dr. Ruby Blanc, Hospital Medical Director at the Dominica China Friendship Hospital. Dr. Blanc, on behalf of those who have worked closely with you and, of course, the rest of Dominica, I'd like to thank you and your staff for the extensive work that you've done, given the challenges over the past year and a half. And we want you to know that we appreciate it. We appreciate all the time and energy expended to ensure that the hospital remains as safe as possible for those who are in your care. So thank you so much. Finally, this evening, we welcome to the podium Superintendent of Police, Anthony Lawrence.
Good evening. First of all, I would like to acknowledge Dr. Sharuddin Ahmed, National Epidemiologist, Dr. Rubiba, Hospital Medical Director, and forever faithful Miss Shena Harry. Good evening, Dominica, and the listening public. I am happy for the privilege to provide updates on our ongoing efforts in the fight against COVID-19. The role of the police in this fight is to support the Ministry of Health in enforcing the COVID-19 laws. Officers have been patrolling the length and breadth of Dominica daily by land and sea. It has been observed that there has been general compliance by the populace. However, there are still too many people who are continuing to disregard the laws. The police have been preferring numerous charges against individuals who have failed to comply with these laws. The laws were enacted for the benefit of everyone to prevent the spread of COVID-19, and the police force will continue to enforce these laws. Let us look at some of the measures in place that we all are required to comply with. Wearing of mask. Everyone in a public place must wear a mask or suitable covering over the mouth and nose. Anyone found not wearing a mask in a public place commits an offense and is liable on summary conviction to a fine of $500. Bars. Large gathering. No more than 10 persons are allowed to gather in any location. Anyone who promotes or attends a large gathering commits an offense. 25 people are now permitted to attend churches, weddings, and funerals. Over the past few weeks, police officers have had to be policing the beaches to minimize the number of people that flock to the beaches and rivers. You are hereby reminded to avoid any crowding of the beach and river. Opening hours of businesses and establishments. All business and establishments are permitted to open from 6 a.m. to 11 p.m. daily. Restaurants are open for dining and takeouts. Restaurant owners are required to have their establishment certified by the Ministry of Health. Bars are allowed to open for business for purchase only and pick up only. There shall be no music played at any bar. There shall be no music played at any bar. There must be no congregation on the premises of any bar, and consumption of alcohol on the premises of any bar is prohibited. All nightclubs shall remain closed. Other restrictions. No one shall host or attend a private party which includes any person from outside of the immediate household of the house occupant. A recreational or competitive sport event. No one shall host or attend a wedding which hosts 25 persons other than the bride, bridegroom, official witnesses, and the marriage officer. No one shall host or attend any social event. No one shall host or attend funeral that has more than 25 people and at least one officiant and essential mortuary staff. Public transportation. A person shall not offer for hire or seek to travel on any motor omnibus unless there is or would be not more than three people per row. Everyone on the omnibus must wear a mask. Quarantine and isolation. Anyone found breaching the protocols will be dealt with according to law. I want to remind you that your health is your primary responsibility and you must take every precaution to safeguard yourself. You are therefore advised to follow the laws of Dominica to avoid any unnecessary embarrassment. Thank you. As we go into the weekend, please be reminded of all of what I've just said, because the police will be out this weekend and every day after. Once again, I want to say thank you.
Thank you so much to Superintendent Anthony Lawrence and, of course, to the entire Commonwealth of Dominica Police Force. We've worked very closely with the police force over the last months since the outbreak began, and we appreciate your continued cooperation. Ladies and gentlemen, your cooperation at every level is essential, including with the police. The laws remain in place for our own safety. I'd like to thank all the presenters this evening, Dr. Shaluddin Ahmed and Dr. Ruby Blah, as well as Superintendent Lawrence, and remind you that vaccination remains our best way to defend against COVID-19. We have 3 vaccines available in Dominica, and vaccination is available island-wide. From Monday to Friday, vaccination is available at all the Type 3 health centers across the island. And if you don't know what a Type 3 health center is, that just means the main health center in your district. So that would be the La Plaine Health Center, Georgetown Health Center, St. Joseph, Marigot, Castlebruce, Roseau, and Grand Bay. They will all be offering you your choice of vaccine. From Monday to Friday, there's also vaccination available at the Windsor Park Sports Stadium. But with the rollout of the Pfizer vaccine, vaccination will also be available at schools based on a schedule. Monday, October 4th, Community High School will be offering vaccination. Northeast Comprehensive and Calls also offering vaccination. In addition to these educational facilities, we have the Collieho Health Center, Agape Elder Care, the Dominica State Prison, and the Buetica Health Center. Vaccination on Monday, October 4th. On Tuesday, Wesley High School and St. Mary's Academy offering vaccinations. On Wednesday, October 6th, Orion Academy and St. Martin Secondary offering vaccinations. For those of you, maybe private businesses or anyone having questions about vaccinations, you may call the vaccination unit at 613-6391, 266-3490, and 266-3408. I remind you as well that vaccination does not work in isolation. It has to work in conjunction with the other health and safety protocols. As Dr. Ruby Blah mentioned, keep wearing your masks, physical distancing, sanitizing, boosting your immune system, respiratory etiquette. All of these work in conjunction to keep us safe. We thank you as always for your attention, ladies and gentlemen. Thank you to our media partners for your cooperation, your collaboration, and we wish you all a very safe weekend. Thank you.